Hello to our friends in Jacksonville, Florida. My name is Philip Rulo with Rultract, and I'm going to go over what I would consider to be the Rultract trauma set. Now, something interesting is you would not want to use your pectus set for trauma. However, you may be able to use your trauma set for pectus. So that being said, let me show you why this piece of equipment is the best for trauma surgery, including scapular retraction, and a number of different procedures as well. So I'll start off with showing you how I would retract the scapula. And Guy, I think you have to agree that once you put this piece of equipment into the hands of a general trauma surgeon and they use it for a procedure, they're going to see the benefits of the equipment, and they may be able to use it for a number of different procedures as well. So what I would do here to retract the scapula, and we have done this many times already, you go ahead and adjust this top post. This top post can be adjusted at 18-degree increments all around the OR table. So what I usually do is just adjust it to about 18 degrees over. Again, we're set up on the patient's left side here. The surgeon's going to be on the patient's right. I adjust it down. Again, this will drop all the way down if need be, but we're going to adjust it to about right here. Lock it into position, and then we have a number of different retractors or attachments that you guys may or may not be interested in. What I would use for scapula here is just a single blade, goes up under the scapula obviously. If the patient is large with a lot of fatty tissue on their back, what we can do is we actually retract the scapula using this, and then once we have it in place, we turn this knob and this part pushes the tissue away to allow for better access to the ribs. Works very well. So I would go ahead and put this into place here. Drop this down under the scapula, and simple enough, I'm just going to retract it. And this provides a very stable and very strong platform. Recently used it on a patient that weighed over 200 pounds, and it worked perfect. And what I found is once surgeons start using this for scapular retraction, regarding the size of the patient, it seems that they'll always use it for every case moving forward. So we go ahead and put this into the incision. I don't have a scapula on my model here, so I'll just have to show you how it would work. And if I wanted to, I could change the access to the incision and to the ribs just by rotating this top rotating extender bar as well. And that will allow me to get to every part that I need to on that plating system very easily with minor adjustments. Now, if I were to want to use it for a different procedure, I can access a different incision very easily just by rotating this again, locking it into position. Maybe I want to bring this back over here now, lock this into place, and then just get down to the incision. And of course, if it's too high at this point, you can take this off, turn it upside down, lock it back into place, and now we're a little bit closer to the incision. So the adjustability, the stability, and the strength of this piece of equipment, as far as I'm concerned, it's the best there is to offer for this type or these types of procedures. And you can adjust it easily on the fly to get to many different areas if you need to. So that being said, that's the Rultract for trauma. And I look forward to speaking to you guys on Thursday about it. And again, if you need me to come down to Florida, I'd be happy to come down. I don't know if you are in your office or not. From what I understand, you are not at this point. But at any time, anything that I can do to help. Thank you all very much for taking the time to watch the video. And again, I look forward to speaking to you on Thursday.